Hey y'all, my name is Morgan Massa, and today I'm going to be performing oral care on Mr. Smith. First, I'm going to check my doctor's orders to see exactly what kind of care we need to do, how often you need to do the care during your shift, and making sure he has no accommodations that need to be met during this care. You're going to check the orders, provide privacy, come in, introduce yourself. Hey, Mr. Smith, my name is Morgan. I'm going to be your nurse for the day. I'm going to perform hand hygiene. You want to raise the bed to a comfortable working level.
Start off from the top, she did not do that, bro. She went straight to the super talking about some walk. Okay, stand up. Get out that different show.
Before I start performing any care, you want to identify the patient and make sure if he is conscious, make him state back his name and date of birth to make sure it checks the wrist. If not, check the wrist to your stuff. And then I'm going to come over here. I'm going to explain to Mr. Smith, hey Mr. Smith, we're about to do oral care. I'm going to have you roll over and so we can start our oral care.
Look, see, I'm going to start brushing your teeth.
Before I roll my patient over, I want to make sure I have the right equipment there ready to go. That way everything is set. So, Mr. Smith, I'm about to have you roll over.
Get the water out.
If you can help me.
And I'll put it back in. I know you can. I put it around. Then I get the little...
I'm then going to place a towel under his head.
I don't think I'm able to put it in there.
I'm then going to perform hand hygiene again. Take off the gloves I put on and had, and then put another set on. I'm going to get another set.
I know we're not playing bumper cars later.
So put my gloves on. I'm going to have my toothbrush. I'm going to moisten it in the water. Put my toothpaste on. Before I brush the teeth, you want to check them out for any lesions, cuts, anything, any abnormalities. That way you can document it before. So you're going to check the mouth. Okay. And then you're going to either open the mouth with a tongue blade or you can use your finger to roll the lip down. In this case, I'm going to use the tongue blade. Pull it down. Brush. Make sure to get all around all the teeth. Make sure to do the tongue at the end. Once you're done, you want to put your toothbrush over here. So then you want to take your basin. You're going to put it under their mouth so when you suction, the water doesn't fall out everywhere. So you're going to put water in your suction bowl. Put the basin under their mouth. Push the water through. And then suction it out.
So can you use that for like perineal again? When you cleaning on them?
After we do that, we're then going to dab his mouth a little bit if there's anything back there. And then you want to take your suction and suction out anything that might be left, any water, food might be in there. You want to make sure to intermittent it, which is taking your thumb on and off because you don't want to block or take too much air out of their airway. So make sure to get everything. Make sure to get all the water. It's important because when you roll them over, you don't want them to aspirate if they're unconscious. So, secretion or suctioning is done. Then I'm going to dab my patient's mouth again just in case there's something on it. I'm going to lift his head, removing the towel and disposing of it. I'm then going to remove my gloves, perform hand hygiene, use some sanitizer, roll him back over into a comfortable position. Make sure he's comfortable. I then want to clean my supplies and make sure they're ready to go for the next time that I need them and to use them, if you can reuse them. You then want to raise the bed rail. You want to lower your bed in the lowest level possible. And before you leave the room, you want to make sure to ask your patients if they're conscious. Make sure, Mr. Smith, is there anything else I can do for you at the time? Making sure that they're set and comfortable. Make sure that the call light is in reach, the bed rails are up, and the bed is at the lowest position. And I'm going to perform hand hygiene and go document.